What are the different types of muscular dystrophy? Muscular dystrophy is a group of inherited diseases that lead to progressive muscle weakness and degeneration. There are several types, each with unique characteristics. Understanding these types helps in managing the condition effectively. Duchenne muscular dystrophy is the most common and severe form. It primarily affects boys, with symptoms usually starting between the ages of 2 and 5. This type causes rapid muscle weakness, especially in the hips, pelvic area, thighs, and shoulders. By the early teens, many individuals lose the ability to walk, and it can also impact heart and respiratory muscles. Becker muscular dystrophy is similar to Duchenne but is milder and has a later onset, typically in adolescence or early adulthood. It results from mutations in the same gene but produces a partially functional protein. Muscle weakness progresses more slowly than in Duchenne muscular dystrophy. Myotonic dystrophy is the most common form in adults, affecting both males and females equally. Symptoms can start between the ages of 10 and 30 but may appear at any age. This type is characterized by prolonged muscle contractions and weakness, beginning in the face, neck, hands, and lower legs. It can also affect other organs like the heart and lungs. Limb-girdle muscular dystrophy affects the muscles around the hips and shoulders. The onset can vary widely, occurring from childhood to adulthood, and it impacts both genders equally. Depending on the subtype, muscle weakness can also involve the heart and respiratory muscles. Facioscapulohumeral muscular dystrophy primarily affects the muscles of the face, shoulder blades, and upper arms. Symptoms usually appear before age 20 but can develop later. Weakness often starts around the eyes and mouth and spreads to the shoulders and arms. Congenital muscular dystrophy is present at birth or within the first 2 years of life. There are multiple subtypes, each distinguished by specific genetic defects. Some may also involve brain or eye abnormalities. This type mainly affects the neck, upper arms, and legs. Distal muscular dystrophy is a rare form that affects the distal muscles, such as those in the hands and feet, usually beginning in adulthood. Oculopharyngeal muscular dystrophy typically starts in the 5th or 6th decade of life, affecting the muscles of the eyes and throat, leading to drooping eyelids and swallowing difficulties. Emery-Dreifuss muscular dystrophy often begins in adolescence or early adulthood, more commonly in males. It is characterized by weakness in the shoulders and upper arms, joint stiffness, and spinal rigidity, often associated with heart issues that requiring monitoring. Each type of muscular dystrophy results from mutations in specific genes that affect muscle structure or function. The clinical course, severity, and treatment options vary by type. Diagnosis typically involves clinical evaluation, genetic testing, and sometimes muscle biopsy. Understanding the subtype of muscular dystrophy is crucial for prognosis and management. While there is currently no cure, treatments focus on managing symptoms and maintaining mobility. It is important to consult healthcare professionals for personalized care and guidance.